Hi, so before doing this procedure, I would make sure to be in proper scrub uniform with my ID badge, and I would also make sure to wear proper personal protective equipment if indicated, gown, mask, goggles, gloves. So before entering the room, I would go ahead and knock, introduce myself. Hi, my name is Acacia. I'm going to be your student nurse for today. I would make sure to go ahead and close the curtain for lack of privacy. And then I would go ahead and perform hand hygiene. And then I would go ahead and identify the patient. Hello, sir. My name is Acacia. How are you doing today? Could you please, and I would look on both bracelets to see where their ID band was. So it's on this side. So, sir, could you please state your full name and date of birth? All right, thank you. So the patient has identified himself. So once I've identified the patient, I would go ahead and then ask for pain. So, sir, do you have any pain? He most likely might say yes, because if he did have a distended valve from urine being backed up, then he might say he had pain. Which, if he did have pain, I would go ahead and just document that. If he did have, I would also ask him if he did have any allergies. So, sir, do you have any allergies? And he would maybe say no, so I would go ahead and document that as well. So after noting if he did have pain or allergies, I would go ahead and explain the procedure to him. So, sir, I just want to explain to you, we're going to do a bladder scan on you, and this is just going to help to see how much urine you might have backed up, since you are having pain and can't void. So that way, depending if he does have over 200 milliliters of urine, the physician might order a catheter to help him void. So first things first, I would go ahead and first lift up this bed to about waist level. And then I would go ahead and perform hand hygiene one more time. And then I would wear gloves. So I'm just going to verbalize I wear gloves. And then I would go ahead and give the patient as much privacy as possible, but we are going to have to uncover his abdomen area. So I would first inspect the abdomen and see, does he have any scars/lesions. Also ask him, I might note some distendedness because of the backed up urine, and I would lightly palpate and ask him to see, to tell me where it might hurt. So once I palpated, then I can kind of see, feel the non-distendedness in the abdomen. So once I've done that, I would go ahead and first I would want to make sure that this would have been disinfected before even bringing it into the room and using it on the patient. And then first I would go ahead and put some gel on the patient's abdomen. And there are some gels that that can be warmed if the patient is uncomfortable with how cold this might be. So I'm just going to lightly put some on, but I'm not actually going to put some on. So I'll go ahead and put some on, and then I would go ahead and turn this on. And then I would press down on it as I scan the bladder, and it would guide me, depending on the photo, where it needed to be. So I'll just go ahead and I want to have it at least 1 inch above this pubic symphysis. And I want to press it downward. Alright, sir, it shows that you have about 280 milliliters of urine in your bladder right now. So going on that, I would go ahead and document that. And so once I've finished using the bladder scanner, I would go ahead and wipe this. Disinfect this with usually an alcohol-based wipe, and then I would go ahead and take these tissues or napkins and wipe off any excess gel that we had on the patient. And then if I had a trash can, I would go ahead and dispose of that right here, but since there's not a trash can near me, I would just leave that there. And so I would go ahead and disinfect this, as I've said, and then I would go ahead and put this back. And then I would, before even having, after I would have removed the gel from the abdomen, I would have made sure to cover the patient right away so he wouldn't be cold. just cover him back up. And so now that we've determined that he does have about 280 milliliters of urine in his bladder, I would go ahead and tell the physician and possibly anticipate a catheter order, but depending on what he says, it's his decision to do that. So I would go ahead and bring this back up, and then make sure to put the bed down to the lowest position. Ask if the patient is comfortable. Sir, do you need anything else? And if the patient was comfortable and didn't need anything else, I would go ahead and take off my gloves and perform hand hygiene and leave the room.